As early as the 16th century, agents to induce seizures were used to treat psychiatric conditions. In fact, Benjamin Franklin wrote that an electrostatic machine cured a woman's electrical fits. Convulsive therapy was introduced in 1934 by a Hungarian neuropsychiatrist called Ladislas Meduna, who induced a seizure first with camphor and then with letrozole. Italian professor of neuropsychiatry Ugo Cerletti had been using electric shocks to produce seizures in animals, and with his colleague Lucio Bini developed the idea of using electricity as a substitute for letrozole in convulsive therapy. In 1938, they experimented for the first time on a person. Cerletti had noted that a shock to the head produced convulsions in dogs. Once they started trials on patients, they found that after 10 to 20 treatments, the results were significant. Patients had much improved. ECT soon replaced letrozole therapy all over the world because it was cheaper, less frightening, and more convenient. Cerletti and Bini were nominated for a Nobel Prize, but didn't receive it. Throughout the 1940s and 1950s, the use of ECT was widespread. In the early 1940s, in an attempt to reduce the memory disturbance and confusion associated with the treatment, two modifications were introduced. First, the use of unilateral electrode placement and the replacement of sinusoidal current with a brief pulse. In the 1940s and early 1950s, ECT was given without muscle relaxants, and the seizure resulted in a full-scale convulsion. A rare but serious complication was dislocation of the long bones. The introduction of succinylcholine in 1951 led to more widespread use of what was called modified ECT, with a short-acting anesthetic usually given in addition to the muscle relaxant. The steady growth of antidepressant use, along with negative depictions of ECT in the mass media, led to a marked decline in the use of ECT during the 1950s and 1970s. In 1976, Dr. Blatchley demonstrated the effectiveness of his constant current brief pulse device. This device eventually largely replaced earlier devices because of the reduction in cognitive side effects. The use of ECT declined until the 1980s, when use began to increase amid growing awareness of its benefits and cost-effectiveness for treating severe depression. Because of the backlash noted previously, national institutions reviewed past practices and set new standards. In 1976, the American Psychiatric Association released its first task force report in which new standards for consent were introduced and the use of unilateral electrode placement was recommended. This was a brief summary of the history of ECT from the Center for Education in Interventional Psychiatry.